દરેક સિનિયર ભાઈ બહેનોને નવા વર્ષના નૂતન વર્ષાભિનંદન. IASO આજે આપણી આ સંસ્થા 2003 થી શરૂ થઈ અને આજે 2025માં આપણે આપણા સિનિયર ભાઈ બહેનોના સાથ અને સહકારથી આજે 6000 ને લગભગ 25 ની સંખ્યા આપણે જઈ રહ્યા છીએ. એટલે આટલી મોટી વિશાળ સંખ્યામાં આપણે સંસ્થા તરફથી જે પ્રોગ્રામો કરીએ છીએ એ દિન પ્રતિદિન સંખ્યા વધતી જાય છે અને ખરેખર ઘણીવાર તો આપણને એવું થાય કે આપણે બુકિંગ પણ બંધ કરવું પડે છે. એટલે આપણી સંસ્થાની જે કાર્ય પદ્ધતિ છે અને જે પ્રોગ્રામો છે એ ટૂરના છે, મંદિર દર્શન છે, વન ડે ટૂર છે, સેમિનારો છે, આ બધા ઉત્તરોત્તર આપણે સંસ્થાની પ્રગતિ તરફ લઈ ગયા છીએ. સંસ્થા 2003માં આપણા રમણભાઈ શાહ જે ખરેખર એમની કાબેલિયત અને એમની પ્રેરણાથી આટલી મોટી સંસ્થા ઊભી કરી શક્યા છીએ. તેમાં અને જે સંસ્થાના પ્રતિનિધિ ભાઈઓ છે એ ખરેખર એમના સૂચનો, માર્ગદર્શન અને એમની પ્રેરણાથી આજે સતત આપણી સંસ્થા મોટી થઈ રહી છે અને સેવા કાર્ય પણ આપણે કરી રહ્યા છીએ. આજના આ દિવાળી બાદનો પ્રથમ સેમિનાર ગટુભાઈ મિસ્ત્રી આપણા હેલ્થ ઇન્સ્યોરન્સ મેડિકેર માટે જે આ પ્રોગ્રામ કરીએ છીએ એ દર વર્ષની માફક આજે પણ આ જ જગ્યા ઉપર આપણે આ વર્ષે પણ પ્રથમ પ્રોગ્રામ મેડિકેરનો કરવા જઈ રહ્યા છીએ. આપના સાથ અને સહકારથી સંસ્થા દિન પ્રતિદિન આગળ ને આગળ પ્રગતિ કરતી રહે અને આપણો સાથ સહકાર સંસ્થાને મળતો રહે. ઘણી વખત કોઈ એવો પ્રસંગ પણ થાય કે કોકને મન દુઃખ થાય કે કોઈને સંસ્થા તરફથી કોઈ અડચણ ઊભી થાય તો મારા વડીલ ભાઈઓ અને બહેનો, આપ તો જાણો છો કે આવડી મોટી સંસ્થામાં કંઈક ને કંઈક ભૂલ થવાની છે અને આપણે ભૂલ કરીશું તો જ આપણને શીખવાનું મળવાનું છે અને ભૂલ સુધારવાનું પણ મળશે. એટલે સંસ્થા આપણી જે કંઈ પ્રવૃત્તિ કરે છે એમાં આપનો સાથ અને સહકાર ઉત્તરોત્તર મળતો રહે અને હવે આપણા પ્રોગ્રામ કરતા રહીએ. અને આપના કોઈ પણ સૂચન હોય સંસ્થાને, મેડિકેર અંગેના હોય કે કોઈ ડોક્ટરનું કોઈ સલાહ સૂચન માટે કોઈ જો દાખલા તરીકે ડાયાબિટીસ છે, હેલ્થનો કોઈ પ્રોગ્રામ હોય, ફૂડ અંગેનો હોય કે શું ખાવું શું ના ખાવું સિનિયરો માટે, તો એ પ્રોગ્રામ પણ આપણે કરી શકીએ. પણ એના માટે તમારા સૂચન જોઈએ. તમને કોઈ સારા ડોક્ટર ઓળખતા હોય તો આપણે ઉષાબેનને મળો અને એમને કહો કે આ એક સેમિનાર કરવા જેવો છે તો સંસ્થા જરૂરિયાતથી કરશે. એટલે સંસ્થાને તમારા વડીલો, આપણે વડીલો એક વિશ્વવિદ્યાલય છે. વડીલ એટલે એવું નથી કે બુઢા લોકો થઈ ગયા એટલે કંઈ કરી ના શકે, પણ આપણે જે ઉંમરવાળા સિનિયર છે એમના માર્ગદર્શન હેઠળ આપણે ઘણું બધું કરી શકીએ એમ છે. એટલે આપનો સાથ અને સહકાર સંસ્થાને મળી રહે એવી આજના આ પ્રસંગે આપ સૌનો હું સંસ્થા વતી આભાર માનું છું. અને હું સંસ્થાનો પરિચય આપું કે ભાઈ સંસ્થામાં તનસુખભાઈ મારું એ અમારા સંસ્થાના પ્રેસિડેન્ટ છે. અનિવાર્ય સંજોગોના કારણે આજે ઉપસ્થિત નથી. રાજુભાઈ શાહ એક્ઝિક્યુટિવ વાઇસ પ્રેસિડેન્ટ છે, એ પણ આજે ઉપસ્થિત નથી. સુનિલભાઈ પટેલ વાઇસ પ્રેસિડેન્ટ છે. ચંદ્રકાંતભાઈ શાહ એ આપણા સીએઓ છે, પૈનો હિસાબ આપણો બધો રાખે છે. મણિભાઈ પટેલ, હું પોતે પીઆરઓ, સંસ્થાના જે કોઈ અહેવાલ હોય કે વિડીયો હોય, ફોટા હોય એ બધું કરવાનું કામ હું કરું છું. વસંતભાઈ શાહ સેક્રેટરી, એ પણ અત્યારે હાજર નથી. કૃષ્ણા વખારિયા એ આપણા જોઈન્ટ સેક્રેટરી છે અને એ સાથ અને સહકારમાં સારી રીતે જોડાયેલા છે અને આપણા ઉષાબેન શાહ ઓર્ગેનાઇઝર, સંસ્થાના ઓર્ગેનાઇઝર, જે સંસ્થાનો પિલર રાજુભાઈ અને ઉષાબેન અને એમનું આખું ફેમિલી એ આપણી સંસ્થાનો પિલર છે. એટલે આ બધા અમારી સંસ્થાના પ્રગતિ માટેના મૂળ પાયાના મૂળિયા છે. જેવી રીતે વડનું થળિયાનું મૂળ જેટલા ઊંડા હોય એ જમીનને પકડી રાખે, એમ અમારે આ સંસ્થાના જે પ્રતિનિધિ ભાઈઓ છે એ આ સંસ્થાને મજબૂત રીતે આગળ ને આગળ વધારે એવું કાર્ય કરી રહ્યા છીએ. પણ એ કાર્યમાં આપનો સૌનો સાથ સહકાર સિનિયર ભાઈ બહેનોનો ના હોય તો આ સંસ્થા કોઈ પણ કાર્ય કરી શકે નહીં. એટલે આપનો સાથ સહકાર કાયમ માટે મળી રહે એવી આપ સૌને સંસ્થા વતી મારા જય શ્રી કૃષ્ણ. ગટુભાઈ આજના પ્રોગ્રામનો ઓર્ગેનાઇઝર, એમનો આજનો પ્રોગ્રામ વર્ષનો પહેલો જ શરૂઆત છે, નવા વર્ષનું સેમિનાર, એટલે ગટુભાઈ મિસ્ત્રીને આપણે તાળીઓથી વધાવીએ.
I thank IASO and their board members અને તમે પણ બધા અહીંયા આવ્યા બદલ ઘણો ઘણો આભાર. અને we gonna talk about something very interesting. અને ગુજરાતી એકલું નહીં પણ થોડું ઘણું મિક્સ ઇંગ્લિશ કરવું પડશે, કારણ કે કોઈ કોઈ વર્ડ તમારા જે મેડિકલના કે મેડિકલના હોય એ થોડા ઇંગ્લિશમાં થાય છે એટલે. Yeah. So we going to talk both together, but it's going to be mixed language, okay? And whatever we are going to do today, it doesn't matter what political party is in the US that you are, or I am. It is going to be everything just based on the facts and based on what the things are out there. So let's start. Thank you so much, guys. All right, so we're gonna start with a lot of things today. We're gonna go over through the affordable care, Obamacare marketplace. We're gonna go through Medicare, Medicaid, and all other things associated with the Medicare and Medicaid and how the change is coming through one big, beautiful bill act. Okay, so the first thing is how the Medicare and Medicaid works. So the Medicare is a program started in 1965 under Lyndon B. Johnson, and there was the first recipient for the Medicare was the Harry Truman and his wife. So the Medicare in the beginning when it started, people those who are 65 and if you have worked and you are a citizen, you are entitled for Medicare. So the Medicare નું જે શરૂઆત થઈ 65 માં થઈ અને પછી Medicaid ની પણ શરૂઆત એ ટાઈમ થઈ હતી, પણ Medicaid was for the low income people and also people those who have a medical disability, means they are medically not fit for it, so they will do the Medicaid. So those two programs started in 1965. 1970 through 2000 જેની અંદર મેડિકેરના જે ચેન્જીસ આવ્યા એની અંદર જેવી રીતે 65 પહેલાં એવું હતું કે યુ હેવ ટુ બી સિટીઝન, ઇટ બ્રિંગ બેક ડિફરન્ટ થિંગ્સ કે તમે ગ્રીન કાર્ડ હોલ્ડર હો તો પણ તમને મેડિકેર મળે, તમને એન્ડ સ્ટેજ રેનલ ડિઝીઝ દેટ મીન્સ કિડની ડિઝીઝ કે કિડની ટ્રાન્સપ્લાન્ટ કરવાનું હોય તો પણ તમને મેડિકેર મળે. અને ત્રીજી વસ્તુ કે તમે ડિસેબલ થઈ જાઓ, જોબ પર કામ કરતા હોય ને તમારી જો 18 મંથની 6 મંથ તમારી શોર્ટ ટર્મ ડિસેબિલિટી અને 18 મંથની તમારી લોંગ ટર્મ ડિસેબિલિટી હોય તો તમે ડિસેબલ થાવ તો 25th મંથ યુ ગેટ ધ મેડિકેર. હવે મેડિકેરની અંદર શું હોય છે કે બે ભાગ હોય છે. મેડિકેરના ભાગ બે હોય, તે પાર્ટ એ અને પાર્ટ બી. જે પાર્ટ એ હોય છે એને હોસ્પિટલાઇઝેશન ટ્રસ્ટ પણ કહેવામાં આવે છે અને એ તમારું હોસ્પિટલમાં જાઓ ત્યારે તમારે 4 વસ્તુ કવર થાય. હોસ્પિટલમાં જાઓ તો ઇમરજન્સી, second thing hospital in the hospice care. Hospice care means that if you're going to die within the 6 months, they do special treatment at the hospital, which is like painkiller and all the other management and other things. Third would be inpatient hospital, means કે હોસ્પિટલમાં રહો એ. અને ચોથી વસ્તુ જે હોય છે એને સ્કિલ નર્સિંગ કહેવામાં આવે. સ્કિલ નર્સિંગ means when you go to the hospital and stay minimum 3 days in a hospital, and after 3 days, doctor says that you have to go to the rehab, that cover under the Medicare Part A, it is called skilled nursing. See, a lot of people has a wrong definition of nursing and skilled nursing. The custodial care nursing, which is there are 6 different activities of the daily living. કે તમે 6 જુદી જુદી એક્ટિવિટી હોય દિવસની. તમે ખાઈ ના શકો, કપડાં ના પહેરી શકો, નાહી ના શકો, ટોયલેટ ના જઈ શકો, એક જગ્યાએ બીજી જગ્યાએ મૂવ ના થઈ શકો, તો તમારે જે 6 જુદી જુદી એક્ટિવિટીમાંથી તમારે 2 એક્ટિવિટી ના થાય, those are called custodial care. અને એ custodial care તમારથી ના થાય તો Medicare do not cover the benefit from the Medicare, because only cover you skilled nursing, which is going to the hospital and go into the nursing home for just the rehab facility. So those are the things you have to remember. Medicare do not cover custodial care, only if you have a long-term care. This is not the subject we're going to talk about, the long-term care, because long-term care comes in with a lot of other things, which is, you know, you have to go to the nursing home, Mukuntakar, or you have to take the home health care, or you have to do the daycare centers, or you have to go to the assisted living facility. Those are the 4 different things comes into the long-term care, and a long-term care benefit તમને ના મળે જ્યાં સુધી તમે મેડિકેડ પર ના હો અથવા તો તમારી પાસે લોંગ ટર્મ કેરનો ઇન્સ્યોરન્સ ના હોય તો એ બાબતનું આખું ડિસ્કશન કરવું આગળ ટાઈમ મળે તો આપણે કરીશું. પણ મેડિકેરના જે 2 ભાગની આપણે વાત કરી, પાર્ટ A અને B, એ પાર્ટ A અને B નું ફંડિંગ કેવી રીતે થાય છે, ઇટ ઇઝ વેરી ઇમ્પોર્ટન્ટ થિંગ. તમે જ્યારે જોબ કરો છો ત્યારે કંપનીની અંદર તમારું પાયકા, એટલે કંપનીવાળા તમારું ડિડક્શન જ્યારે કરે ત્યારે કંપની કન્ટ્રીબ્યુટ, યુ કન્ટ્રીબ્યુટ, અને એ પાર્ટ એનું પ્રીમિયમ તમે ત્યાં એટલે કન્ટ્રીબ્યુશન કરતા હોય છે. એટલે તમે જ્યારે રિટાયર થાવ 65 10 વર્ષ કામ કરેલું હોય તો તમારે પાર્ટ એનું પ્રીમિયમ હોતું નથી. પાર્ટ બી નું પ્રીમિયમ તમે જાતે ભરો છો અને આ વર્ષે $185 છે, એ તમારા સોશિયલમાંથી કાઢવામાં આવે, અને એ પાર્ટ બી નું પ્રીમિયમ આવતે વર્ષે $206.50 થાય છે જાન્યુઆરીથી. It is gone up 11%. Amari social security fund gonna go up to I think 2.9 or 2.7%. So whatever they give you, they take it back. That sort of thing is going on. એટલે મેડિકેરનું પાર્ટ બી નું જે પ્રીમિયમ ભરે છે તે તમે ભરો છો. તદ ઉપરાંત ફેડરલ ગવર્મેન્ટ એ લોકોના જે જનરલ રેવન્યુ હોય એમાંથી પણ એ લોકો કન્ટ્રીબ્યુટ કરે છે. એટલે ઘણીવાર પાર્ટ બી નું જે ઉપર નીચે થાય છે બેઝડ ઓન આખા જે એક્સપેન્સીસ થતા હોય એના પર હોય છે. આઈ થિંક 4-5 વર્ષ પર એકવાર પાર્ટ બીનું પ્રીમિયમ ઓછું થયું હતું, પણ આઈ થિંક એવરી યર ઇટ ગોઝ અપ કારણ કે એક્સપેન્સીસ ગો અપ. સો મેડિકેર એ અને પાર્ટ બીનું જે ફંડિંગ થાય છે ઇટ ઇઝ વેરી ઇમ્પોર્ટન્ટ ફોર ફેડરલ ગવર્મેન્ટ. હવે આપણે આગળ જઈએ તો 65માં આપણે જે વાત કરી તે કે જે 65માં મેડિકેડ આવ્યું ત્યારે બહુ ઓછું પ્રોવિઝન હતું કે કોણ કોણ મેડિકેડ લઈ શકે. 1970 through 2000 એ લોકોએ બીજું એડિશનલ વસ્તુ કરવામાં આવી. એની અંદર મેડિકેડ માટે જે પ્રેગ્નન્ટ વુમન હોય, પીપલ વિથ અ લિટલ ચિલ્ડ્રન, પછી તમે ડિસેબિલિટી થઈ ગઈ હોય, તો આ બધી વસ્તુનું જે એડિશન કરવામાં આવ્યું હતું એને લીધે મેડિકેરના ચેન્જીસ થોડા બીજા થયા હતા કે જે એની પોવર્ટી લેવલ હોય, દરેક સ્ટેટની પોવર્ટી લેવલ જુદી હોય, ઇટ્સ કોલ્ડ ફેડરલ પોવર્ટી લેવલ, અને એ પોવર્ટી લેવલથી 138% તમારું વધારે હોય ત્યાં સુધી તમને આ બેનિફિટો મેડિકેડ થ્રુ મળતા હતા. અને એનું જે પ્રીમિયમ અને જે બેનિફિટ મળે છે એ સ્ટેટ વાળા પેલું કરે, પરંતુ ફેડરલ ગવર્મેન્ટ કન્ટ્રીબ્યુટ મોસ્ટ ઓફ ધ મની, એટલે 70 to 80% money that goes to the state to provide the funding for Medicaid benefit. 2000 સુધી everything was nice. Then came in 2010. 2010 ની અંદર Obama came back and he said, Obama bring back Obamacare. So the Obamacare started in 2010. I was one of those panelists during the TV Asia on the 2010, I remember. And this thing is start continually improved and improved. 2012 comes and the government came back and the government said, okay, we're gonna do the 100% funding, but we're gonna do expansion of Medicaid. Expansion of Medicaid came in 2012, and government says, okay, we have to do it all the states. So the Supreme Court came back and they said, you cannot force all the states to take the money and use it for all the expanded Medicaid system. So out of them, it become mandatory, but instead of mandatory, they say, okay, 40 states plus the District of Columbia, they took participation into expanded Medicaid system. Now, expanded Medicaid system means the people, those who were between 19 and 64, they were not having any kind of a, the subsidy they used to get. So the government came in and said, okay, we're gonna start doing it for 19 to 64 based on their income level, exceeding the 138% to 200% to 300% to 400%. So more people involved, more people got into it, more people with the younger from 19 to 64, they all got into the Medicaid system and they were getting the benefit up to that point. Government is contributing the money, government says, okay, we're gonna continue keep doing it. 2021 and 2022 came in. 2021 year the American Health Recovery Program, and also there was another program, Biden Inflation Reduction Act. આ બે એક્ટને લીધે કોવિડ ટાઈમમાં they had a lot of people lost a job, lots of people don't have the money, a lot of people had difficulty getting the health insurance. So the government said we're gonna incorporate with these two laws to give you more money and give you a system they call enhanced tax credit. So there are two tax credits. One tax credit originally started and gone very well, but when the 2021-22 came in, they put an enhanced tax credit. Now this enhanced tax credit, what it did is, તમારે જે બધા ઇન્સ્યોરન્સના 400% સુધી હતા એ બધાને વાંધો નહીં હતો, પણ જે above that point હતા કે જેની પાસે unlimited income, unlimited business, unlimited, everybody jumps on the thing because the government say, okay, we're gonna give you a tax credit. So if the insurance costs you $1,000, they say, you pay only 200 and 800 will pay for it. So the federal government came in, started contributing all the money until now, because they said everybody has to be insured. So most of the businesses, most of the company, they got rid of the employees that come out from the job and they took the insurance because everything was cheap, because the federal government is putting all the money together. 2025 came in, July 4th, and OVA came in. OVA is the One Big Beautiful Bill Act by Trump. This one has a different characteristic. It says, okay, we're gonna take off on January 1, 2026, an enhanced tax credit, which is the tax credit was given to the people above the 400% poverty level. So all these people on January 1, 2026, if they go into the act, they will lose the insurance through the marketplace. They will have to buy their own insurance because the government is not going to subsidize any of these plans going forward. That's why right now the government is shut down, because enhanced tax credit has to be taken off for Democrat the Republican, and Democrat says keep it on, and these two things doesn't happen by November 1. We don't know whether it's gonna open up the marketplace on November 1 or not, because they're also gonna go November 1 to December 15, and right now we don't know until November 1 comes. So the government shutdown is based on tax credit has to be either lifted off or changed or leave it as it is. So we'll see what happens. So this is all Medicaid system. Also in the OVA law, means if you are on the Medicaid, and if you go into getting a medical, the tax credit from the government also bringing a lot of rules and regulation. Means if you are getting the health insurance and if you are on that situation, you will have to show 80 hours of work or training or the school. You cannot sit home not having to do anything and get the medical benefit because the government is providing you. So those are the things gonna change. A lot of things is going to change for the between 19 and 64. That's not our big subject. What we're going to talk about is now go back to the Medicare system. All right, so the Medicare system is, right, we talked about the Part A and B. Now, once you have the Part A and B, you have a different way, you have, a lot of people has an option. So once you retired at 65, you have to take the Medicare Part A, and that comes in free. If you're going to keep working beyond the 65, then you don't have to get the Part B, because the Part B is the medical, and that is not required, because when you're working, your Part B will be covered by your employer. And then you don't have to pay the premium. That's another thing. So those reasons a lot of people continue working until 65, 70, 75. When you come out to the company, you are not going to get into a late penalty, but because you had a coverage from your employer, which is called creditable coverage, you are not going to be charged with the penalty. And then you take the Part B, and then you go into the Medicare, and then you take a different option. So the Medicare, once you are a part, 65, or when you come out from the group plan, you have two different options that you have to pick. Either Medicare remain as a primary, or some people say, okay, I want to go each and every hospital, each and every doctor. So that in that case, you want the Medicare to be primary, and then you select Medicare supplemental plan. And these supplemental plans are different company or different carriers, which is like United Healthcare, Aetna, Humana, Cigna. All these companies, they are the private companies. So what the private company does is, when you come out from the 65, or when you come out from the group, you will not have to worry about going through the medical underwriting. So they will issue based on guarantee issue or open enrollment. So that's a lot of thing, a lot of people took it, and they already have it. So if you have United Healthcare, you have either Plan F or Plan G or Plan N. So there are 3 different plans that they usually have it. Used to be the Plan F, discontinued in January 2020. The reason they discontinue is because deductible Part B na deductible je supplement ma hoy, Part B na deductible 257, Part F, Plan F do not pay the deductible. So they say, because that deductible usually goes to the CHIP, which is the Children Health Insurance Payment, and they refuse to pay. So Medicare came back and said, okay, you cannot sell anyone the Plan F beyond, if you are turning 65, beyond January 1, 2020. So whoever has it now, they can have the Plan F because the grandfather. Those who are turning 65, but they were before January 1, they can still buy the Plan F. But those are the things is the Plan F. And then there's a Plan G and Plan N. Now the Plan G and N has one-time deductible on the Part B, which is 257 you pay to whenever you go to Part B services, which is doctors, outpatient lab, X-ray, medical equipment, all this considered to be under the Part B. And that is going to be applied first time in a year. And after that, in the Plan G, you don't have to pay any co-payment to the doctor visit. Plan N will charge you $20 for each office visit. So the Medicare is your primary, Medicare supplemental plan is your secondary. So you can go to any doctor, any hospital, and it will cover you almost everything. So that's a lot of people can afford it, they go for it. People can afford it, don't get into it because it costs you the money. Every year the Medicare supplement premium goes up as you age yourself. Now when it comes to the point when you want to change from one supplement to another supplement, United Healthcare has 2 different plans. One plan that they had originally with the gym benefit, the new one they come out with without the gym benefit. One with the gym benefit, whoever has it now, Plan F, G or N, they are allowed to move in and out of any plan, anytime by calling the customer service. If you have the new one, the one doesn't have gym, if you are in the G or N or F, you cannot move. If you want to move, you have to go through the medical underwriting. Medical underwriting means they're going to ask you medical question, and based on their, whoever is going to be there, take care of the, the writing up and everything, medical underwriting, and they will say yes or no, or they may say it's going to cost you more money. So those are the things, people, those who want to move from one supplement to another supplement, make sure you are going through medical underwriting before you disconnect your existing plan. Now, Medicare supplement also doesn't cover your prescription plan. So whoever has a Medicare supplement, they have the prescription plan, different kind. They have a WellCare, they have Cigna, they have different companies. Now remember, 2020, 22, when the Biden Inflation Reduction Act took place, before that, you have a prescription plan coverage with the 4 different parts in the system. Means if you have a prescription plan, first phase is your deductible phase, second phase is called initial phase, third phase is called donut hole used to be, and the fourth one is called the catastrophic coverage. Biden time, they say, okay, let's do something. We're gonna reduce the people, those who are going into the donut hole, paying $8,000, $7,000, $9,000. 8% people, they had a problem. So in order to solve their problem, they came with the conclusion that we're gonna do the maximum out of pocket going to be $2,000. So if you look at it in 2025, maximum out of pocket is $2,000. So whatever medicine that plan covers you, and if you go to $2,000, you don't have to worry about rest of the year. But that, you can set it up with the prescription plan company and say, okay, MPPP means Medicare prescription plan payment, they can charge you every month $166 up to end of the year. And if you don't use it, then they reimburse you the money. So all this prescription plan had 4 different phases at that time. When they reduced this $2,000, they say, okay, we're gonna take the donut hole out, and $2,000 they put it in the system. Now the donut hole is gone, and a lot of people get benefit out of it because they are costing them less money than $8,000. That's only 8% people. But 92% people, those who were not in the donut hole, got punished. And that's where all this coming back. Because all the pharmaceutical company has to revise their premium, has to revise their co-payment, has to take some medication out of the system. That was happening. And this year, all the insurance company, prescription plan company came back and they said, we're gonna take revenge. So they started taking up all the premiums higher level. Their medication can be changed from tier 1 to tier 2 to tier 3 to tier 4, anything they could change. So these are the things is affecting a lot of people with Medicare supplement with the prescription plan. Make sure your prescription plans are covered right now, is going to be covered similar way starting from January. WellCare had a 0 premium, they went to $240. This year they gone to $22.80 per month. Their medications are also maybe changing, so whoever has it, look at it. Cigna had a $9 premium plan going to $59. So all this thing is going crazy, especially the prescription plan. And if you don't change it, then January 1 comes, you cannot change anymore. This thing not only affected the prescription plan, but also Medicare Advantage plan. So when we look at the Medicare supplement and prescription plan, that's the one scenario. The second option that a lot of people has it is the Medicare and Advantage plan. Now, when you are on the Advantage plan, which is also called Plan C, they also include D and everything. That plan gets the money from the CMS, Central Medicare, give them every month $800 to $1,000 to do the managed care. So these are called managed care company. United Healthcare, Clover, Cigna, Humana, all these companies, they are called managed care company. And the managed care company gets the money from the government. Medicare also throw all the benefits from the Medicare to the plan, and the plan make up a plan every year. They are the called Medicare Advantage plan. It has a more benefit than the Medicare because they have more value and more things they add. They add into dental, they add into your eyeglasses benefit, the over-the-counter items, the worldwide coverage. All these things comes in together as a bundle, and that's why a lot of people, those who can afford to go to Medicare supplement, they go into the Medicare Advantage plan. Now the Medicare Advantage plan, originally when they started, they used to be HMO plans. HMO plans means only you have to go through their network around in the area where you live. They were nice and nice. After that, somebody thought about, let's do the PPO plan. So the PPO plans are the one they allow you to go in network as well as out of network. Because a lot of people say, I'm not just gonna be here only, I'm gonna be also traveling, or I'm gonna be going to another state and live there for a few months. So the PPO came into existence, and a PPO na je benefit on lide, and a PPO ni je flexibility share. In a lide, everybody jump on the PPO plan. So the PPO plans are very good plan. They develop with a zero premium because they get the money. They also take care of all the things without going through no referral, no authorization. Everything is fine until last year. This year they came back and all these companies say, oh, we lost the money. Take an example, Raven Health. Very good company, came from the Blue Cross. Blue Cross lost because they had a lot of issues. The Raven Health came in. Raven Health came in market last year. Now this year they pulled out because they said they lost the money. Government will allow them to pull the money out. So Middlesex County, Raven, the PPO plan used to be no longer available, so you have to change your plan. So these are the thing is the now trend going through coming years. So the coming years is gonna be, they wanna bring back the HMO plan. So United Healthcare has three major plans, 004, 005, and the number 6 plan. 004 used to be zero premium plan, they raised it up to $45. 005 plan has a premium of $47, they bring it up to $72. That plan is still good, but the PAD used to pay that money for a lot of, I'm going to talk about the PAD later. The PAD is paying their premium, $47. They're also going to pay the $72. The only thing they changed that is not a good thing is the specialty doctor when you go to or therapy you go to used to be $10, now it becomes $30. OTC reduced from $50 to $45. So whoever has that plan want to keep it is fine because United Healthcare has the network all over the country. So if you have a daughter or son and you want to go stay like 3 months or 4 months and take care of it, I think United Healthcare will still work there. So when you decide, make sure your medicines are covered, your doctors are covered. Now we go back into another plan is the Clover Health. Now it's becoming a name of the game that everybody wants more benefit with the less headaches and everything. So Clover started in 2010 in New Jersey, Jersey City, and was not that great, but now they develop a lot of relation with the doctors. They also give you more benefit. No one else has increased benefit, they are the one increasing the benefit. So everybody this year jumping on the wagon of Clover, we don't know what's gonna happen next year. Now the Clover has one drawback, they are only in 5 states in US. New Jersey, Pennsylvania, South Carolina, South Carolina, Texas, and Georgia. All other states, it will work only for emergency or urgent care. So you're gonna wanna make sure you don't have any relative or friends or anybody where you wanna go and stay there 3-4 months and you wanna do the blood test or do something else. It's not gonna be possible with the Clover. So the Clover has a plan, they give you a lot of benefit. One of them is the popular plan this year is the 054. Because they give you $110 back in January for your Part B. So if you're going to pay $206.50, they're going to give you $110 on your Social Security back. So you're only going to pay $96. So people say, let me go into this plan. And if you look at the benefit, they still have a dental benefit this year. They didn't have last year, $1,000. They have, glasses benefit. They have over-the-counter $50. They also have, but the only specialty is $50. But people don't go to therapy or specialty visit. It's fine. So that they usually like to select. And now they want to go and January it will start. Now once you want any one of these plans and you get into select, now you will select something and January start. But January 1 comes, and if you want to change it, you are still allowed to do one more change. January, February, and March. Any one of this month you can change. At that time, you can do from January to February, February to March, and March to April. After that, you cannot change the plan. So make sure once you are in the wrong plan, you do the changes during the January, February, and March. So these are the things is called OEP. Right now, what's going through October 15 through December 7 is called Annual Enrollment Period Time, AEP. So these are the two different definitions of the thing. Now, whenever we talked about all this plan, the benefit, other thing, other also people has to think about there are other benefits available. You may not be able to, maybe know, but like few low-income subsidiaries called LIS. Take an example, one of them, first one is called Extra Help. Extra Help is usually for the people on Medicaid because it comes from the government, by Social Security Administration, and that extra help, if you have your assets level is less than 35, means your bank balance 401 is less than $35,000, or your income is less than about 30,000, you would be able to get a letter from the extra help, and that letter you can bring into the pharmacy, and pharmacy will honor you for $1.10 for generic and brand name would be a $3.30. So those are the things can happen if you are in that situation. There's a second one, I think a lot of people has it, it's called PAD. PAD is called Pharmaceutical Assistant for Aged and Disabled. Now this is possible for a lot of people because they don't take any bank balance 401 IRA into account. Only they would take is your income. Income is your Social Security income before deduction, plus your tax, interest, dividend, everything together for a married couple, no more than $60,000. And a single would be $50,000. So anyone need those kind of things to be done, see me, or I can give you the form, or I can fill it out for you. That will help you in the sense that when you go buy medicine, it will not cost you more than $5 for generic, no more than $5 to $7 for the brand name. It's a yellow card that you have to show to the pharmacy. It takes about 2 to 3 months. But that automatically renews, so you don't have to worry about once you get it. So that's the second thing. And the third is called Medicare Savings Program. I go back onto the PAD again. PAD also will allow you to have some sort of, if you have an electric and gas bill, if you're paying for it, they give you discount on it. So these are the things come through the state of New Jersey. Now the third one we're talking about is called Medicare Savings Program. Medicare Savings Program is also called SLAM, Specified Limited Medicare Beneficiary. At that point, if you have less than $11,000 in the bank, the 401 IRA, if you have less than $22,000, $24,000 income level, you will be entitled for, it's called SLAM or Medicare Savings Program, and that time you don't have to pay the Part B premium. It also goes with the state of New Jersey, PAD, SLAM, and the electric and gas, all those things comes together. So whoever wants to need on those things, I can help them out. It's a 25 pages application, but it's going to help you to some people, those who are in the low-income subsidiary. Now also, there is also a question sometimes come, because if you have an EMA, you're paying higher premium in the Part B. Similarly, if you have Medicare Advantage plan and if your income is higher and there is a prescription plan built into the Advantage plan, at that time, you're going to pay the IRMA related to your prescription coverage. So those are the things you have to worry about or look for it. Whenever you sell a property, your income goes up, your Part B premium is going to go up. At the same time, your Advantage plan will have a prescription built into, that's going to go up. So those are the things you have to make sure when you sell the house, your money comes in, that's your income, and that's going to make up your Part B premium. Now on the prescription, we talked about what are the prescription and how it covers. So the prescription has 5 different tiers. They call tier 1, tier 2, tier 3, tier 4, and tier 5. Tier 1 is the generic medication which is on their plan, but it's a generic. Tier 2 is called non-preferred, means it's a generic medication, but it is not on their plan. T3 is called the preferred generic, means a generic brand name, but it's on their plan, so it is called preferred brand. And if the brand name is not listed on their formulary, it is called non-preferred brand. And the number 5 here is usually they comes in from newly in the market, and those are the medicine they charge you percent rather than the fixed amount. So these are the then T1, T2, T3, T4, and T5. So anytime you have any plan, and if you have those medication into different tiers, and if you want to move it because you came across in the middle of the year and you're going to need that, you can go to your doctor and ask him if you have another medication that will change. Or you can ask the doctor to call the plan and put them onto the lower level, so you don't have to pay that much co-payment. Some of the people have a new medication that comes in the market and they cost a lot of money. So I advise them, I say, if you look at the manufacturers and call them up, customer service, and tell them, listen, this is a new medication, it cost me like $10,000, but can you help me? So they'll send you coupon, they can help you a lot of ways. Sometimes even ordinary medicine, if you see in a plan, they're going to cost you money. Going to a lot of websites they have it, including like goodrx.com. Goodrx.com, if you put it in the medicine, and if you see it's cheaper than what you're buying on your plan, go and buy it. You don't have to use it on your plan, because it's cheaper than going through your plan benefit or pharmacy you go to. So they have a coupon, goodrx.com, they give you coupon, go to different places like Walmart, CVS, wherever you want. Take the coupon, go there, and get it done. So these are all little things that you have to remember, how the Medicare works, how the Medicaid works. Now the Medicaid, I don't know how many people are on the Medicaid, but the Medicaid has also a lot of things is going to change, because under the OBA, means One Big Beautiful Bill Act, there is another program, it's called MAHA. MAHA is like Make America Healthy Again. It is going to be by Robert Kennedy, and also it is going to be Dr. Oz is taking care of it. So these are the things they want to do, all the check in the Medicaid system, fraud, waste, and abuse. So in the sense that they're going to do a lot of verification. Usually if you're on Medicaid, you once in a while you get some verification. If your income, your sources are this much, just sign it and send them back. But now they are going to do more than one time, maybe several times in a year, to make sure everybody's here and taking the benefit of Medicaid in the state of New Jersey. Anytime you're on Medicaid, if you leave the state or if you leave the country more than 29 days, you are not allowed to use any benefits out of the country. When you go to India, and if you leave 29 days or more, you have two offices you have to notify: Social Security Office and Medicaid Office, Social Service Office. એટલા માટે કે જે તમારે મેડિકેડ પાર્ટનું બીનું પ્રીમિયમ જે મેડિકેડ ભરતા હોય, they will have to stop. They have to hold it, and then when you come back, you go back to the Medicaid and ask them, I'm back again, and start my Medicaid. So you have to notify them in writing, not by calling them, because sometimes somebody do not put the notes on it, but make sure you're going to notify them that I'm going out of the country, and upon arrival, I'll notify you. So when you come back, at least you have proof that you are out of the country, but you are not using the benefit out of the country. So those are the things. Okay, so I think I'm approaching the point. I think most of the things discussed. Long-term care, one more thing I want to talk about it. See, a lot of people, I think we are all in the same boat. 20 years ago when I started selling the long-term care. And I was so much disappointed because our community never believed in going to nursing home. And the reason for it, because we were that time, 20 years ago, we were young, we were healthy, everything fine. At the time, everybody should have taken the long-term care. To all your money right now, be safe and secure. The long-term care benefit is very difficult to get at this point in time. એટલા માટે કે આપણી health situation is not that great. our age is also higher. અને જે બધા મોટી મોટી કંપનીઓ જે લોંગ ટર્મ કેરના ઇન્સ્યોરન્સ વેચતી હતી they also phased out કારણ કે they were losing a lot of money and a lot of people are going into the nursing home and taking advantage of it. So now the insurance company has decided something different. It may be good for some people, those who are healthy here, but jo healthy તમે ના હો, so I would recommend for your children who are like 40 or 45 or 50 years old, ask them to do this for future, for their future, because you don't know what they're gonna get in the retirement. And it is called life insurance policy with the living benefit. So if you wanna write down, ask your agent, whoever is your insurance agents are, and ask them, see if they can approach them and get a life insurance policy with the living benefit. It is the policy the companies are selling now. So in the past, આપણે શું કરતા હતા કે we used to buy the insurance એટલા માટે કે if you die, at least your beneficiary get the money to pay off your mortgage or pay off your kids' school. But now, suppose if you are 45 years old and if you're traveling and you get hurt and you paralyze yourself, what are you gonna do? How are you gonna get the money? So this policy is the policy do whenever you have those areas, means 2 different activities of daily you cannot perform, you can pull the money out from your face value of the policy. So say somebody took the $400,000 insurance policy, and if they think about something happened to them, they can have those 2 areas and they can call the insurance company, and insurance company say, okay, we're gonna give you $100,000 back from your policy to use it for your medical expenses or whatever you need for it. And that way, at least you don't have to worry about, funding yourself, going to either home health care or nursing or whatever you want to do. And your $300,000 is still there. You keep going, and after a few years, you pass away. Your $300,000 would be given to your beneficiary. So what is this policy is you are using your benefit while you are living. Whereas the other policy used to be where you put the money and only die, you don't see the money to you, but it will be your beneficiary. So this is, I think, advising you to all your children, ask them to look into it, tell them, call their agents. If they have a old policy with a cash value on it, ask them, see if they can 1035, they call it, means take the cash value, put it into this policy and get more benefit, because your premium would be lower by using the cash value, and that way at least you can help your children. Because we didn't help ourselves, but I think we can help our children. I think it's very important. At this point, most of the kids are maybe 40, 45, that age. So that's one thing I would recommend for everyone. And any other questions or other thing we're gonna go through?
Are you selling that policy?
Huh?
Are you agent for the policy?
No, I'm not doing it.
No.
I have a lot of things to do. I love to do it. If the next year comes in, they stop all the commission to the agent, I think that may happen, then I will think about it. I think there are a lot of companies now not giving commission to a lot of agents, like all the prescription plan, like there's a new Walmart Humana plan came out. A lot of people were saying about the $20.80 on a healthcare, but there's a Humana has a $4 plan came out. But make sure your medicines are covered, because that plan is not that great, and if you're just taking it because you're not taking in medication, but when it comes to the point when you're gonna take a few medicine, it's gonna cost you probably more money. So make sure you check that medicine level, what you're taking now, before you decide to switch to $4 plan.
You still have to pay IRMA on that.
Hmm?
You still have to pay IRMA
Yeah,
on that $4 policy.
yeah. Any prescription plan, either it's in a separate plan or it's in advantage plan, you're still going to pay IRMA, because IRMA is related and it's not gonna go away. IRMA is like income related Medicare beneficiary.
Right now, I have a Clover Health Insurance,
Right,
Medicare Advantage,
right,
032 plan.
right.
So is there any other plan better than this?
Okay. 032 is the Middlesex County, is also, they move another plan into in Middlesex, is 004. 004 is better than the 032, in the sense It has more dental benefit. Instead of 1,500, it's 2,000. Also, it has, I think, $110 on the OTC compared to 100. And I think your special therapy is 15 compared to 25, something like
What
that.
about the prescription drug for diabetes? I'm paying right now $47 for 30 tablets.
Yeah, look at the plan has a deductible on it. So if the 004 and 032 has the same deductible. So whatever it costs you, it would cost you the same thing.
What about 5-4? 54?
5-4 has, I think, some deductible on it too. But deductible only applies those who are going to go through the, like a brand name. So don't worry about that, the deductible if you don't have any brand name. But if you look at the United Healthcare, they have a deductible of, I think, $500 to $600. Yeah.
GoodRx supplement plan for pharmacy. They've been advertising that you pay like $10 a month and your medicine is covered with a good price. Is it good to take it?
What plan is it?
GoodRx.
Yeah, GoodRx has a.
They are selling plan too, like monthly.
You don't have to take because you don't have to be a member. You can just go GoodRx and just have the coupon comes in, take a picture and go
Yeah,
to.
but monthly plan gives a good break.
Yeah, you can take that one too. If you think that you have medicine that helping you, you can become a member of the GoodRx and you can use it. That's fine too.
What's the difference between 054 and 061 of Clover Health?
Huh?
That will help.
Clover Health 054 and 061. What are the major differences?
61, I don't think 61 has a prescription plan. Look into it.
Yeah.
61 don't have
Not
prescription.
covered.
Okay, whenever the prescription not covered, you don't want to take that plan because then you're gonna get a penalty. You don't get medicine. You cannot buy the medicine. So you cannot buy 061 unless you are a veteran. If you are a veteran and if you're getting a prescription plan from your, military or other, TRICARE or something, then it's fine. Those people don't want medicine at all, and if they have a late penalty, they can do that if you want to do that. If you have a late penalty, then you can do that.
004 और 03 में मेन डिफरेंस क्या है?
Huh?
004 और 032 में मेन डिफरेंस क्या है?
004 and which one?
032.
32. Yeah, only couple of differences. One is the dental is higher on 004, and also I think the specialty is different price, I think, or therapy is little different, and it has a 110 compared to 100 on the OTC. Not big difference. But if you're moving with the more $500 more on dental, you should move it to. Doesn't matter.
So does it cover in other states also? Other states also cover करता है कि नहीं?
No, it is covered only in 5 states. New Jersey, Pennsylvania, South Carolina, Texas, and Georgia. Other state it will work only emergency or urgent care.
What about foreign travel?
That is out of Europe.
Hmm?
That's out of
They said
No, emergency is not going to be considered out of network because emergency will have to be taken care of it. Once emergency is over, then you have to go back to the network.
Like in the Thai state, if you are other than the Thai state, something happens, you are out of emergency, you are still in hospital.
Right. Then you have to do whatever you gotta do. You have to come back to New Jersey once you come out of the
It
hospital.
is totally not.
No, you cannot go for regular with nothing. You cannot.
Overall, which plan is the best?
There is no best. There is no best. It's based on what you're looking for. See, you, your neighbor, or your friend is different. Think about you. If you want to spend money and time or whatever you want to do, it is up to you. You don't want to spend money and take a 054 because a lot of people go to India 4 months, 5 months, and they don't use therapy or go to specialty. They take that plan because you're saving $110 every month. And then whereas somebody is like, there is another plan is 007. If you're paying like $34 to $31 on the plan 007, it's a great plan. Go ahead because it's cover you by pad and also primary is 0, special is $2, therapy is $5, dental is $2,500, $170 for OTC. You can't expect better than that, $31 premium plan.
Is Blue Shield eliminated completely, the plan, the Braven plan is completely eliminated?
No, Braemer is not completely eliminated. Middlesex County, the PPO plan is gone.
It's gone.
They also have a freedom plan where you pay the premium. But agents are not allowed to enroll, so you have to enroll by yourself.
Oh, okay.
So what are the criteria to switch between Part A, B to C?
Hmm?
Right now I'm in Part A and B.
And a supplement.
And supplement.
Right.
If I want to switch to C.
Why you want to do that?
I want to
You
understand.
can afford it?
Yeah, it's getting very expensive.
Okay. Usually, if you're living in a house and if you go to the apartment, what happened to you? That's a situation I always describe to the people. Okay, if you're in a supplemental plan, if you want to go to advantage plan, you're degrading yourself. Unless you're really in a money crunch and can afford it. Supplemental are the best thing to be in it because if you end up in a hospital for 365 days, it will cover you everything. You don't have to worry about it. Most of the advantage plan, if you look at it, there's out of pocket. And a lot of people don't know what the out of pocket is. Out of pocket means when you go to the hospital, and if you look at the daily inpatient charges, $390, 1 through 5 days. So you go into the hospital, stay for 5 days, cost you like $2,000. That is your out of pocket. Now, if you go the second time, it's going to happen the same thing. When you end up to like $8,000, rest of the year, if you go to the hospital, doctors, outpatient lab, any of those facilities, you will not have to pay anything. So that came through the Obamacare. It started with the $3,000 to $4,000 in the beginning. Right now, $7,000, $8,000, $9,000. So everything goes up, the out of pocket goes up. But don't worry about it because that's not you gonna eat unless you go to the hospital 4 to 5 times in a year.
You are allowed.
They increase 2026, 399 for up to 1 to 6 days.
Yeah.
You are allowed to change from advantage to plan G or F.
Yeah, I told you, whenever you change from advantage plan to supplemental plan,
Like F or G, whatever the better plan is.
okay, but you're on advantage plan and you want to change to supplemental plan. That's what you're asking?
I don't know what is the F plan, plan F or plan G, whatever.
Okay,
These are
so there are two different options that I told you, the Medicare and you have Medicare supplement. So Medicare primary, supplemental. Supplemental has 3 different plans, plan F, G and N. Other side, you have a different option where you don't spend the money, but you pay as you go, which is the Medicare Advantage plan.
You are allowed to switch from
You are allowed to switch from
advantage.
advantage to supplement with the medical underwriting after, in the beginning of the time, when you're 65, they don't ask you, but when you are like, job, when you come out from job, they don't ask you. But after staying into the advantage plan, and if you want to move to the supplemental plan, after a year, then you have issue that they're going to ask you medical question. And if you have, because a lot of companies ask you, what's your doctor, what's your prescription, they go through your MIB, which is the Medical Information Bureau, and the underwriter may say, oh no, we're not going to take you because we are the private company. So usually if you can afford it, if you want to stay with it, stay with the Medicare supplement, it has a more benefit. But if you want to get out because you cannot pay or you have an issue, then do it. But if you are in a supplemental plan, my suggestion, don't do it because we're going to leave the money here. We are not taking the money with us. Health is the important thing when you retire. And a lot of people don't think about it, the health. But every plan has gym benefit. How many people take a gym benefit? How many people go to different things that they have? It's a lot of things that they have. All the preventive cares are free. You go colonoscopy, you go mammogram, you go prostate cancer, bone density, everything is free. Take it. A lot of people don't take it. Even Clover has the program called Healthy Reward Program. Once you are in a Clover, you call the customer service and tell them, I want to join into the Healthy Reward Program. $400 you can get for the whole year. As soon as you call them, they ask you some medical question, your prescription, whether you walk with a stick, whether you walk with a walker. They give you $200. That $200 you put in your card. You go to Walmart, they give you healthy food. You can buy milk, bread, fruit, juice, vegetable, no soda. But At least you get out of it. Plus, when you go for blood test, they put you $25 in it, and then you go get that $25 food in there. So these are the things, all the preventive camps come from the Medicare, they are free for you all year. Colonoscopy, you go every 5 years. But these are all the things that government putting in to make you healthy and, rewarding yourself for doing something.
These facilities not in United Health.
Hmm?
These facilities not.
No, United Healthcare had the nurse used to come to your home and they used to do the checkup, your prescription and all those things, and they used to send you like $25, $50 debit card and all those things. They shut down all those things. United is pulling out all the money, all the benefits and everything now. So you have to think about, they are also pulling out all over the country. A lot of counties, they are pulling out the Advantage plan. So I don't know the future of all these companies and all what they're going to do. Even Clover this year will be different. Maybe next year come in the middle of the year, and we don't know what they're going to do in 27.
In United Health no healthy food.
No, they don't have healthy food. Braven had it. Braven had even Papa program. I mean, you know the Papa program.
Still have it.
They still have it?
Yeah.
Yeah, the Papa program is good because they will allow you to somebody to come to your home and do your loan cutting and everything. That's why they lost some money. Because they gave up too much and they came back and said, oh, lost some money. So the government said, okay, shut it down. So Middlesex County, no more Braven Health.
So you said that changes are happening in United Medical Advantage.
Right.
What about the regular?
Supplemental have no changes. Supplemental plan benefit they cannot change because they are all universally designed, universally kept it as it is. Only thing they change is your premium every year.
They changed twice last year.
Hmm?
They changed twice last year.
Yeah, because the reason they do twice is because the COVID time they did not increase and the AARP came back and they wanted more money. So first time United Healthcare has increased a bundle of amount of money on your premium. I have the same thing. So, and now it's too late sometimes to go to another company, so you have to stay with it and live with it. Any other question? That's it?
Five state cover coverage, right?
Huh?
Lower five state cover coverage.
Right.
If I will travel instead of five, not one in five,
Right.
then if I want to go for emergency, it's covered.
Yeah, emergency is covered. Emergency is covered anywhere in the country as well out of the country. All the Advantage plan and as well as Medicare supplemental plan. But you have to, out of the country, you will have to pay money and bring back the bill. In this country, you don't have to because they will bill to the plan.
યુનાઇટેડ હેલ્થકેરમાં એડવાન્ટેજ પ્લાનમાં કોઈ ફેરફાર થયા છે
Yeah.
બેનિફિટમાં?
I told you 004, 005 and plan 6. Back again. 004 no je zero premium hatu, it went up to $45. So 004 is no good. 6 ni andar there is no premium but there is no dental. 005 has dental $1,500 and the premium is $72. Unless you have a pad, then it pays for it. Pad will pay for it. If you have the pad is the great thing. So whoever wants to do the pad, after my December 7 enrollment is over, come to my office, I'll fill it out for you. It is a very good program, people those who are making less than $60,000.
What is the maximum limit for five?
60,000.
60,000.
60,000.
So 005 is good.
Yeah, 005 is still good. Only thing is they raise up the specialty doctors is $30 instead of $10. Used to be $10 for
Yeah, right now we have.
therapy and also the specialty used to be $10, now it's $30. Okay, ask me the question rather than talking. Any other question?
So should we keep the 004 or 005?
I would not put 004 because you're paying $45 for nothing. So Instead of 4, I think moving to 7. I mean 5. Pay 72, 45 plus some more money, but you get more benefit. $50 of dental benefit, that actually costs you every month $55, $50 more. So moving to 005.
For PAD, you said 60,000 is the limit
Right.
per individual. But it counted as the social security income?
All social
Only
security, social security benefit in before deduction. Also your any interest, dividends,
That
any
counts.
401 like 1099, if you get an RMD, that also goes in your, that's a drawback, yeah. Go ahead. Take a minute, 1 second.
આપણા પાસે મેડિકેર પાર્ટ બી એ બી હોય
Hmm.
અને પછી તમારા પાસે અત્યારના સપ્લિમેન્ટ હોય પણ હવે તમારી જોબ તમે લીધી હોય then you can stop Medicare Part B for some time or and
You
you
can do
can
that,
get the you can get the insurance from the job.
You can go and request them you want to leave the Part B, but you have to tell them you have a coverage from your employer. Because then otherwise you will be tagged with a penalty. And when you come back, you have to get the letter from there that you were working for the company and you want the Part B back. Because the Part B and Part D has a penalty. So when you turn 65 or when you come out from the job, and if you don't take the Part B, that Part B has a penalty of 10%. So a lot of people go to India and they take the Part B out because they have to pay the money. It's not good if you want to come back again. You cannot enroll any time during the year except January 1 through March 31st. And that time you have to pay 10% penalty for every year that you are not here. So it is 185 plus 1850 1 year, $37 for next 2 years, and that penalty will stay with you for lifetime. And if somebody has a penalty that's judged by the company wrong way, you can also do appeal. There's a company called C2C. You know that, right? C2C?
Yes, yes.
Because his was determined by the plan that he did not have coverage. So he was tagged with a penalty. But we had to fight with them, with the C2C company, to get his back the penalty out. Or another way you can get the penalty out is if you are eligible for extra help, which is the low income social security program that will take away your penalty.
Is there any reduced payment or plan B just not staying here?
You still have to have the Part B. So that's why.
Reduced payment, I don't say.
No. Okay, so his question is if you leave from here to go to India and if you don't want to pay the Part B or reduce the premium, they don't do it. That's why the Clover 054 help you because $110 they're going to give you and you come back and your plan is still live. I would do that way. I would not. Because once you leave, you cannot enroll into the Part B January through March. So you're losing that benefit plus you're going to get late penalty. And that's a lifetime late penalty.
આપણે every year એને એ કરાવવું પડે ગવર્નમેન્ટ
Yeah, કરાવવું.
every year મારી પાસે છે રાઈટ યુનાઇટેડ
Branches.
એડવાન્ટેજ યુનાઇટેડ
Right.
તો હવે ઓક્ટોબર આવે તો મારે ફરી રિન્યુ કરાવવું પડે કે ઇટ્સ કન્ટિન્યુ
If you want to keep the same plan, you don't have to renew it. But if you want to move from 004 to 005, you have to write another application to do it. Yeah. So I have an office in Edison, so you can come to there too, in a quick travel. Monday, Wednesday, Friday, 12 to 5.
Do you charge consultation fee?
Huh?
Do you charge?
I don't charge anything. It's a service to our community and see, I was an engineer and I retired and I thought about, I said, helping the, seniors and keep my brain going. And my wife is not in favor of keeping myself into 7 days now. And I'm ending up like 7 days every day. Her name is Dina, she's my wife and I just want to introduce everybody. But this is the thing that I love because I love to educate people, learn something, understand something, and do the right thing for you. Because I don't care if you're my agent or, my client or not, I would still help you because it's my, instinct that I would like to make everybody understand how the things should work. And if you look at it, like United Healthcare, I'm a premier platinum agent. If you take 100 agents and take one agent, that's me. So it is kind of thing that I love to work with you, all you seniors, and I'm really respected. And IASO NGA has done a very good job promoting this situation where we would like to bring everybody onto a common platform. Same thing, I think you should do more stuff like, like health fair or something like that. Another seminar I think we were thinking about is the immigration and the laws are changing. So we're gonna talk about this. Thank you, Saben, and all the board members, and thank you all of you for coming down. Saben.
Thank you, Gatu. Thank you, Gatu. આજના આ ઇન્સ્યોરન્સ સેમિનારનો એક સફળ પ્રોગ્રામ એમની મારફત IASO દ્વારા થયો અને આપણા સિનિયર ભાઈ બહેનોને આઈસોના મેમ્બરોને કોઈ પણ વખતે જ્યારે જરૂર પડે ગટુભાઈની એમની ઓફિસ તો અહીં છે એડિશનમાં એમ જ છે ક્વિક ટ્રાવેલની ઓફિસમાં જ એટલે જ્યારે જરૂર પડે ત્યારે તમારે ત્યાં આગળ એમની સલાહ સૂચન મુજબ અને એમનો ફોન નંબર એમનો એડ્રેસ એમનો કોન્ટેક્ટ કરી શકો છો અને જ્યારે જ્યારે જરૂર પડે ત્યારે એમને ગટુભાઈનો કોન્ટેક્ટ કરજો આજના આ સેમિનારમાં આટલી મોટી સંખ્યામાં આઈસોન તરફથી તમે હાજર રહ્યા એ બદલ આપ સૌનો હું સંસ્થા વતી આભાર માનું છું.
Okay, my phone number is 9. There's a card here too, 973-594-0261. 973-594-0261. I have a business card here too.
આપણે નાસ્તો મૂકેલો છે બ્રેકફાસ્ટ તો બધાએ નાસ્તો કરી શાંતિથી આપણો પ્રોગ્રામ પૂરો કરાય.